Mr. Bharat Ram, you of course had a tragedy in the family, when Manju Bharat Ram, one of the country's best known and leading educationists, actually passed away thanks to cancer. Was that one of the factors that really caused you to start CAPED, where you're really in CAPED looking at prevention and early detection, but that tragedy must have really also spurred you to this?
Yes, Vikram, that was one of the major reasons for my involvement in cancer prevention. And I just want to share with your viewers that, cancer is something which is very often in Indian society looked at as a disease where the patient becomes a pariah. And it's important for us in our culture to understand that if you have got cancer, that it should be treated with sympathy and it should be treated with a sense of having bad luck in getting cancer. So this is my first message to people who are viewing your program, that do not in any way look at somebody getting cancer as having had bad karmas or have had some kind of a history which led them to get cancer. So this is my first message. Now coming to CAPED, which is something that a few of us started in Delhi. This is short for Cancer Awareness and Prevention and Early Detection. And we are focusing largely on cervical cancer. It's not very well known that cervical cancer affects young girls to middle-aged women much more than even breast cancer does. And the fact that this is not known widely, particularly in India, is unfortunate, because this is a very, very treatable disease. And I would like my colleague in CAPED, Mridu Gupta, to talk a little bit about what we are doing in CAPED and how we are trying to prevent cervical cancer.
Mridu?
Yeah, hi Vikram. So CAPED, as the name says, it stands for Prevention and Early Detection of Cancer, and we are trying to spread awareness of this prevention. Cervical cancer, India is the single largest contributor to cervical cancer deaths in the world. 1/4 of the world's cervical cancer deaths come from India. And it is a needless waste of life, because it is the most easily detectable and most easily preventable cancer. In fact, since you're doing children's cancers, there is a vaccine available for girls from the age of 11. 70% of cervical cancer is caused by a viral infection, the HPV. It's a virus infection. And the FDA clears the vaccine for administration from the age of 11 to 45 years of age. So if children were to take it at that age, they would be protected. It's efficient against almost 70% of cervical cancers. It's that easy to prevent. Other than that, of course, you have the pap smear that must be taken once after the onset of sexual activity. And all you need to do is get a pap smear done, and along with that, an HPV DNA test done. And then if both the tests are clear, you're clear for 4 years. So that's once in 5 years you need to get a test done.
Right.
And you are 100% cervical cancer free. And yet we lose so many women. 1 woman every 8 minutes we lose to cervical cancer in our country.
Right. So the fact that there's a vaccine for this is something which is obviously a very major, something which is very major. But Mr. Bharat Ram, if you come back to the real problem in a place like India about early detection, the cost of these things is very high. How many people can actually afford to go in for things like screening or testing? It becomes a big concern. So to be able to get low-cost detection or find ways that they can be more low-cost, I believe in some parts of Ethiopia and even in parts of India, things like vinegar swabs can be sometimes used to get some sort of detection done. Is that one of the ways to go? If we can bring the cost of detection down a lot, then maybe it makes it much simpler for people to be able to find out what's happening.
Vikram, there is no doubt that tests must be devised which are relatively inexpensive, and they can be done very easily by even less qualified doctors, even by physicians, so that one doesn't have to spend a lot of money going to a hospital to get these tests done, even in, let's say, primary health centers, etc. So we do need to bring down the cost. And I think there is enough technology, there are enough scientists in India and elsewhere in the world who can actually drive the costs down. And this is one of the things that I hope that we will be able to do with the kind of support that we are now seeing for prevention of cancer. I would just like to add one thing that Mridu said, because I think it's important to understand this from the context of India. In the United States, there are virtually no more women who get cervical cancer, because every child from the age of 11 onwards is inoculated against cervical cancer. So the incidence of cervical cancer is almost gone in the United States. Now, if we could just do this in India, as just like we do polio treatment for children, if we were to just do inoculations for all young girls after puberty, I think we would avoid the costs, we would avoid the heartbreak and heartfelt problems that families have to go through, which would be something which is very easily done. So
right.
I would say that we must become aware of this, and we must make our people aware of this.
All right, so something as simple as that, a vaccination that could actually prevent cervical cancer, is something that we definitely need to keep in mind. Mr. Bharat Ram, thank you so much, Mridu, for joining us with some of those thoughts, and let's certainly hope to that vaccine.
I would just, Vikram, sure. if I may just say that I would like to donate some money for the cause. So I will be giving 5 lakhs for you. Please put that into your account.
Right, Mr. Bharat Ram, thank you so much for joining us with that. And I think the more and more people who come forward to try and help, especially with child cancer and people who can't afford it, that's really great. Thank you so much, Mr. Bharat Ram.